Hi, I'm Dr. Anna Lembke. Welcome to a special episode of After School. Today we're going to be talking about dopamine and how to find balance in the age of indulgence. So without further ado, let's dive in. According to the World Happiness Report, which ranks 156 countries by how happy their citizens perceive themselves to be, people living in the United States reported being less happy in 2018 than they were in 2008. Other countries with similar measures of wealth, social support, and life expectancy saw similar decreases in self-reported happiness scores, including Belgium, Canada, Denmark, France, Japan, New Zealand, and Italy. Researchers interviewed nearly 150,000 people in 26 countries to determine the prevalence of generalized anxiety disorder, defined as excessive and uncontrollable worry that adversely affected their lives. They found that the richer countries had higher rates of anxiety than the poorer ones. The authors wrote, "The disorder is significantly more prevalent and impairing in high-income countries than low to middle-income countries." The number of new cases of depression worldwide increased 50% between 1990 and 2017. The highest increases in new cases were seen in regions with higher sociodemographic index, especially in North America. The question is, why in a time of unprecedented wealth, freedom, technological progress, and medical advancement do we appear to be unhappier than ever? In this video, I present 5 big ideas that outline how an increase in access to pleasure causes a degradation of mental health and how to find balance in an age of indulgence. To understand the roots of this issue, we must start in the brain. Big idea number 1, the pleasure-pain balance. One of the most important discoveries in the field of neuroscience in the past 100 years is that pleasure and pain are co-located. By that I mean the same parts of the brain that process pleasure also process pain. And pleasure and pain work like a balance. When we feel pleasure, the balance tips one way. When we feel pain, it tips the other. One of the overarching rules governing this balance is that it wants to stay level. After any deviation from neutrality, our brains will work very hard to restore a level balance, or what neuroscientists call homeostasis. For example, I like to watch videos of American Idol. When I watch, my brain releases a little bit of the neurotransmitter dopamine in my brain's reward pathway, and my balance tips slightly to the side of pleasure. But no sooner has that happened than my brain adapts to the increased dopamine by down-regulating my own dopamine receptors and dopamine transmission. I like to imagine this as little gremlins hopping on the pain side of my balance to bring it level again. Not very scientific, I know. But here's the thing about those gremlins. They like it on the balance. So they don't hop off once it's level. They stay on until it is tipped an equal and opposite amount to the side of pain. This is the after effect, the hangover, the come down, or in my case, that moment of wanting to watch just one more video. If I wait long enough, the gremlins hop off the balance, neutrality is restored, and that feeling passes. But what if I don't wait? What if instead I watch another video, and another, and another? Pretty soon, I'm no longer watching American Idol videos. I'm watching videos of people watching videos, alternating with memes of Dr. Pimple Popper. If I keep doing this for hours a day, days to weeks, weeks to month, I end up with enough gremlins on the pain side of my balance to fill a whole room. They are camped out for the long haul, tents and barbecues in tow. Once that happens, I've changed my hedonic set point. Now I need to keep watching videos not to feel pleasure, but just to feel normal. As soon as I stop watching, I experience the universal symptoms of withdrawal from any addictive substance: anxiety, irritability, insomnia, dysphoria, and mental preoccupation with using, otherwise known as craving. This is the hallmark of the addicted brain. Big idea number 2, dopamine overload. This fine-tuned balance of ours has evolved over millions of years to help us approach pleasure and avoid pain. It's what's kept us alive in a world of scarcity and ever-present danger. But here's the problem. We no longer live in that world. We now live in a world of overwhelming abundance. The access, quantity, variety, and potency of highly reinforcing drugs and behaviors has never been greater, including drugs that didn't exist before: texting, tweeting, gaming, gambling, sugar shopping, vaping, voyeuring. The list is endless. Online products with their flashing lights, celebratory sounds, laudatory likes, bottomless bowls, and the promise of ever greater rewards just a finger click away are engineered to be addictive. The smartphone is the equivalent of the hypodermic syringe delivering digital dopamine for a wired generation. If you haven't met your drug of choice yet, it's coming soon to a website near you. Yet despite increased access to all these feel-good drugs, or as I hypothesize, because of it, we're more miserable than ever. Rates of depression, anxiety, physical pain, and suicide are increasing all over the world, especially in rich nations. Our compulsive overconsumption has led not just to increased psychological suffering, we are literally consuming ourselves to death. 70% of world global deaths are attributable to diseases caused by modifiable behavioral risk factors like smoking, physical inactivity, and diet. The leading global risks for mortality are high blood pressure, tobacco use, high blood sugar, physical inactivity, and obesity. In 2013, an estimated 2.1 billion adults were overweight, compared with 857 million in 1980. There are now more people worldwide who are obese than who are underweight, except in parts of sub-Saharan Africa and Asia. The poor and undereducated, especially those living in rich nations, are most susceptible to the problem of compulsive overconsumption. They have easy access to high-reward, high-potency, high-novelty drugs, at the same time that they lack access to meaningful work, safe housing, quality education, affordable health care, and race and class equity before the law. This creates a dangerous nexus of addiction risk. Over the course of my 20-year career, I have seen more and more patients, including otherwise healthy young people with loving families, elite education, and relative wealth, presenting with depression, anxiety, and/or full-body pain in the absence of any identifiable disease or tissue injury. Big idea number 3, dopamine fasting. A patient of mine, a bright and thoughtful young man in his early 20s, came to see me for debilitating anxiety and depression. Dropped out of college, he was living with his parents and vaguely contemplating suicide. He was also playing video games most of every day and late into every night. 20 years ago, the first thing I would have done for a patient like this was prescribe an antidepressant. Today, I recommended something altogether different, a dopamine fast. I suggested he abstain from all screens, including video games, for 1 month. "What?" he said. "Why would I do that? Playing video games is the only thing that gives me any relief." "Well," I said, "let me explain." My patient came back a month after having abstained from all screens, reporting feeling better than he had in years. Less anxiety, less depression. Why? Because when he stopped bombarding his reward pathway with dopamine, he gave his brain the opportunity to restore baseline levels of dopamine firing, in other words, a level balance. He was more surprised than anyone that he felt better. It's hard to see cause and effect when we're chasing dopamine. It's only after we've taken a break from our drug of choice that we're able to see the true impact of our consumption on our lives and the people around us. Big idea number 4, self-binding. My patient was able to return to playing video games without getting depressed or anxious by keeping the gremlins in mind. First, he restricted his video game playing time to no more than 2 days per week, no more than 2 hours a day. That way, he left enough time in between for the gremlins to hop off and for balance to be restored. He avoided video games that were too potent, the ones that once he started he couldn't stop, and that way he avoided accumulating more gremlins on his balance at once than he could handle. He designated one laptop for gaming and a different one for schoolwork to keep gaming and classwork physically separated. Finally, he committed to playing only with friends, never with strangers, so that gaming strengthened his social connections. Human connection itself is a potent and adaptive source of dopamine. For myself, I took my patient's lead. I still watch American Idol videos, but I try to keep it to no more than 2 days a week, no more than 2 hours a day, and preferably with friends and family. I avoid Dr. Pimple Popper altogether. How about you? What's your drug of choice? The thing that once you start, you have trouble stopping, or the thing that makes you feel good in the moment, but worse afterward? Consider the smartphone itself as a possible culprit. Whatever your drug of choice, I challenge you to give it up for a month, or a week, or even a single day. When you do, notice how at first your pleasure-pain balance tilts to the side of pain and you feel restless, cranky, and most of all, preoccupied with using your drug. Your brain's screaming out all the reasons why you should use, even though you committed to a period of abstinence. But if you wait long enough and the gremlins hop off and balance is restored, you'll find you're free. Your mind is less preoccupied with using, you're more able to be present in the moment, and life's little unexpected joys are rewarding again. If and when you decide to go back to using, remember to create literal and metacognitive barriers between yourself and your drug of choice so you don't go to war with your gremlins. Bottom line, to reset your dopamine brain, first abstain. Big idea number 5, pain as a pathway to pleasure. Pressing on the pain side of the balance can lead to its opposite, pleasure. Unlike pressing on the pleasure side, the dopamine that comes from pain is indirect and potentially more enduring. So how does it work? Pain leads to pleasure by triggering the body's own regulating homeostatic mechanisms. The pleasure we feel is our body's natural and reflexive psychological response to pain. With intermittent exposure to pain, our natural hedonic set point gets weighted to the side of pleasure, such that we become less vulnerable to pain and more able to feel pleasure over time. Just as pain is the price to pay for pleasure, so too is pleasure the reward for pain. In the late 1960s, scientists conducted a series of experiments on dogs that, due to the experiment's obvious cruelty, would not be allowed today, but nonetheless provide important information on brain homeostasis, or leveling the balance. After connecting the dog's hindpaws to an electrical current, the researchers observed the dog appeared to be terrified during the first few shocks. It screeched and thrashed about, its pupils dilated and its eyes bulged. Its hair stood on end, its ears lay back, its tail curled between its legs. Expulsive defecation and urination, along with many other symptoms of intense autonomic nervous system activity, were seen. After the first shock, when the dog was freed from the harness, it moved slowly about the room, appeared to be stealthy, hesitant, and unfriendly. Over subsequent electrical shocks, its behavior gradually changed. During shocks, the signs of terror disappeared. Instead, the dog appeared pained, annoyed, or anxious, but not terrified. For example, it whined rather than shrieked and showed no further urination, defecation, or struggling. Then, when released suddenly at the end of the session, the dog rushed about, jumped up on people, wagged its tails in what scientists at the time called a fit of joy. With repeated exposure to a painful stimulus, the dog's mood and heart rate adapted in kind. The initial response, pain, got shorter and weaker. The after response, pleasure, got longer and stronger. Pain morphed into hypervigilance, morphed into a fit of joy. Now, I'm not recommending you shock yourself to get high. The dog experiment is merely an example to illustrate the indirect outcome of painful stimulation. There are, however, many healthy examples to pursue pain. a 10-minute ice-cold water bath, fasting, exercise, breathing techniques, yoga, martial arts, sensory deprivation, or any effortful activity. Let's, for example, look at exercise. Exercise increases many of the neurotransmitters involved in positive mood regulation: dopamine, serotonin, norepinephrine, epinephrine, endocannabinoids, and endogenous opioid peptides or endorphins. Exercise contributes to the birth of new neurons and supporting glial cells. Exercise even reduces the likelihood of using and getting addicted to drugs. Exercise has more profound and sustained positive effects on mood, anxiety, cognition, energy, and sleep than any pill I can prescribe. But pursuing pain is harder than pursuing pleasure. It goes against our innate reflex to avoid pain and pursue pleasure. It adds to our cognitive load. We have to remember that we feel pleasure after pain. Pursuing pain instead of pleasure is also countercultural, going against all the feel-good messages that pervade so many aspects of modern life. Buddha taught finding the middle way between pain and pleasure, but even the middle way has become adulterated by the tyranny of convenience. Hence, we must seek pain out and invite it into our lives. We all desire a respite from the world, a break from the impossible standards we set for ourselves and others. It's natural that we would seek a reprieve from our relentless ruminations. Why did I do that? Why can't I do this? Look what they did to me. How can I do that to them? So, we're drawn to any of the pleasurable forms of escape that are now available to us. Trendy cocktails, the echo chamber of social media, potato chips, fast food, porn, immersive video games. The list really is endless. Addictive drugs and behaviors provide that respite, but add to our problems in the long run. What if, instead of seeking oblivion by escaping from the world, we turn toward it? What if, instead of leaving the world behind, we immerse ourselves in it? I urge you to find a way to immerse yourself fully in the life you've been given, to stop running from whatever you're trying to escape, and instead stop and turn and face whatever it is. Then I dare you to walk toward it. In this way, the world may reveal itself to you as something magical and awe-inspiring that does not require escape. Instead, the world may become something worth paying attention to. The rewards of finding and maintaining balance are neither immediate nor permanent. They require patience and maintenance. We must be willing to move forward despite being uncertain of what lies ahead. We must have faith that actions today that seem to have no impact in the present moment are in fact accumulating in a positive direction which will be revealed to us only at some unknown time in the future. Healthy practices happen day by day. May you find the balance. Thanks for watching this episode of After School. I really hope that these animations help you in your daily life, balancing dopamine and living a flourishing life. Thanks for watching.